Hey everybody, welcome back. This lesson is about malignant brain tumors as demonstrated in CT imaging. First, we need to have a way of categorizing the different types of brain tumors. All brain tumors can be classified as malignant tumors or benign tumors. A malignant brain tumor is a type of cancer, meaning it has the ability to invade surrounding brain tissues and spread to other parts of the body. The most common malignant brain tumors include glioblastomas, astrocytomas, medulloblastomas, and cerebral metastases. Benign brain tumors are non-cancerous, but of course that does not mean they are insignificant. They can still be quite serious and even fatal. Benign simply means that they generally do not invade other tissues and do not spread to other parts of the body. The most common benign brain tumors include meningiomas, pituitary adenomas, and acoustic neuromas. The focus of this lesson is malignant brain tumors, starting with glioblastomas. Glioblastomas, or GBMs, are the most aggressive and most common malignant primary brain tumor in adults. They are a type of glioma. Remember that the term malignant means that glioblastomas are a cancer with the ability to spread to other parts of the body. The term primary brain tumor means that this lesion originates in the brain. It does not come to the brain from somewhere else. The term glioma just refers to the cellular origin of the tumor. There are many types of gliomas, with glioblastomas being the most serious. They typically present as a single, large, irregular, ring-enhancing mass with central necrosis and surrounding edema. This patient has a glioblastoma with these characteristic features. Notice that the outer edge of the tumor is brightly enhancing with contrast. That is a classic feature of a glioblastoma. Also notice that the center of the tumor is not enhancing because it is necrotic. That refers to an area of cell death. Finally, the entire tumor is surrounded by an area of edema, which is the dark area of fluid accumulation around the tumor. This image was acquired with intravenous contrast, and here's why that is so important. The image on the right is the first scan performed on the patient without intravenous contrast. The large area of edema is obvious, but the tumor itself is otherwise invisible. That's why CT imaging of brain tumors must always include a scan without contrast and then another scan with contrast. The next malignant brain tumor type is astrocytomas. Astrocytomas are malignant primary brain tumors. They are also a type of glioma. They typically present as a single, large, irregular mass with diffuse, poorly defined borders without enhancement. They can appear throughout the brain, but especially the cerebrum. This patient has an astrocytoma and it has these features. There's a very large mass, it has an irregular shape, and there are no clearly defined borders. This scan was performed with intravenous contrast, but the tumor is demonstrating virtually no enhancement whatsoever. This is a classic example of an astrocytoma. When we compare this contrast-enhanced image to the original scan without contrast, we see something important. These images look almost exactly the same because astrocytomas generally do not enhance with contrast. That's one reason we know that this is an astrocytoma rather than a glioblastoma. A glioblastoma would have demonstrated clearly defined ring-enhancing margins, but this tumor does not. The next type of malignant brain tumor is medulloblastomas. Medulloblastomas are the most common malignant primary brain tumor in children. They present as a hyperdense, well-defined midline mass adjacent to the fourth ventricle. They can include a mix of cystic and necrotic content. The tumor in this patient fits that description. There's a very large midline mass in the area of the fourth ventricle. This scan was performed without contrast, and the tumor is hyperdense, meaning it is brighter and more dense than the surrounding brain matter. The last type of malignant brain tumor is cerebral metastases. Cerebral metastases are the most common brain tumors. They result from cancer spreading to the brain from other parts of the body. Unlike all of the other brain cancers we've discussed so far, these are are not primary tumors. They did not originate in the brain. They spread to the brain from a primary cancer that existed somewhere else in the body. They typically present as multiple, well-defined ring-enhancing lesions with surrounding edema. It's definitely possible for cerebral metastasis to appear as a single lesion, but it's very common for them to appear in multiples, as in this patient. We can see several well-defined tumors that enhance with contrast, and they are surrounded by a small area of edema in most cases. That's the typical presentation of cerebral metastases. Thanks for watching. That's been a review of malignant brain tumors.